Hey, you guys, I miss you. Hope you're staying safe. See you soon.
Hey everybody, we miss y'all so much and we cannot wait to see y'all again. I hope y'all are staying safe and enjoying your time at home.
Hey everybody, I miss you all so much. Be glad when you get back. Bye.
Hey everybody, we're here working for you. We miss seeing you guys. Can't wait for y'all to get back and hope it'll be soon. Thanks.
Hey everyone, we miss you.
World. And today we have Miss Cheryl Gibson here to talk to us a little bit about the pandemic.
Hey everyone.
And how we can stay safe. So first off, Cheryl, could you just give us a little information on what a pandemic is?
Okay, Macy, so a pandemic is when you have any kind of situation, or say for instance in this case a disease that is something that affects the entire world, not just a subset of a population, but everybody worldwide. And that's what we're dealing with right now with the coronavirus.
Okay, and could you give me a little bit more information on what the coronavirus is and some other names for it?
Okay, so people use COVID-19 and the coronavirus interchangeably, but actually COVID-19 is a subset of a disease of the coronavirus. It's a new coronavirus. The old one was SARS. That was actually COVID-2 is what that one was called. And so that's why they named this one COVID-19, to separate it out. But it is a disease that is affecting any and everyone. Some people are more likely to get it than others. Some people are more likely to have severe complications with it than others, but it does affect everyone.
Okay, wow. So what are some ways that we can stay safe from this virus?
So the biggest thing with it is not being exposed to the virus. So then, of course, naturally the next question is, how do you refrain from being exposed?
So how can you become exposed to the virus?
So you become exposed to the coronavirus through contact with the droplet nuclei. And what that means is when people cough, when people sing, when people sneeze, they emit the droplet nuclei from the mouth and it hangs out in the air. So people end up touching it, they end up inhaling it, it ends up coming into the eyes. Any way that it has to get into your body, then you become exposed to it and you will either see signs and symptoms of it or you'll be asymptomatic. But it can land on surfaces, you can touch those surfaces, you can end up touching your face, your eyes, which is why they tell you to refrain from touching your face and eyes and to hand sanitize often and all of that stuff. But you get exposed to the droplet nuclei and having contact with it.
Okay, and so what are some different ways that we can prevent getting this virus?
Glad you asked that. So Macy, you were asking about how we keep from being exposed to the virus. So some of the things that we talked about earlier was that the droplet nuclei can spread into the air. It can hang out in the air for a certain period of time. It can also land on surfaces. So you want to do frequent sanitizing and cleaning of the surfaces. Lysol seems to be the #1 thing of choice to use for sanitizing and cleaning surfaces. And you just want to make sure that you get everything all nice and clean right there. The other thing, obviously, is washing your hands frequently, because people do not realize how much they touch different surfaces, how much they touch things from the outside that other people have touched, mail and all of that stuff that has been all over the place. You want to make sure that you wash your hands. So I'm going to go ahead and wash my hands now. One of the things that people need to keep in mind that they want their water to be nice and warm. You want to be good and warm, and you want a good antibacterial soap. So I'm letting my water get nice and warm. I'm going to go ahead and get my soap. And the key is you want to make sure that you wash your hands thoroughly. And I usually wash almost up to my elbows. And you want to wash for at least 20 seconds. They advise you to sing a segment of Old MacDonald, recite the Lord's Prayer, anything to help you remember 20 seconds. That's what you want to do. And so that's what I'm doing. I normally like to go ahead and get my paper towel. And you want to blot your skin dry. People aren't paying attention to the fact that when you wash your hands more, you're at risk for breaking down the skin integrity. So it's always better to blot your skin dry than to wipe it. And then usually I just take that and cut it off.
So Cheryl, what are some ways UCP is helping to prevent others from getting this virus?
Okay, so since the city of Tuscaloosa has now made it mandatory that masks must be worn, UCP is not allowing anybody who does not have a mask to enter the building. The other thing that we're doing as we go into UCP, our nurse is going to meet somebody at the door and they're going to check their temperature. Anybody having a fever will not be allowed to enter into the building. One thing that I also want people to keep in mind, even though we are still wearing the mask because that is mandatory, is that people definitely need to practice social distancing, and they recommend 6 feet of distance between people at all.
So Cheryl, I know UCP will be following some of the CDC guidelines by encouraging social distancing while individuals are here during the program. I know in each activity room, we're going to have a limited amount of people in each room so they can socially distance, as well as on the transit. We'll have a limited amount of individuals that can ride the transit at one time to encourage that 6 feet social distancing.
That's perfect. That's perfect.
So Cheryl, now that we've talked about a few preventative measures we can take to keep from getting the virus, can you tell us about some signs and symptoms of the virus?
Absolutely. So the signs and symptoms, they range greatly. They range from everything from a fever to chills to malaise, extreme fatigue, muscle and body aches. A big one that a lot of people tend to notice is the loss of taste and smell. So those are just some of the things that you want to look at, but keep in mind that a lot of people are asymptomatic before they even realize that they would test positive for the virus.
And what exactly does asymptomatic mean?
Asymptomatic means that they are without symptoms. So they may feel normal, they may feel fine, and then randomly they might have to take a test for whatever reason and it turns up positive.
Is there a vaccine available for this virus?
Currently, there is no vaccine for the virus. It's just all of our practices and measures are to slow and prevent the spread of it. But as of right now, there is no vaccine for the virus.
Cheryl, so what are some testing locations in Tuscaloosa that you know of?
So I know that DCH will do a test. I know that there are different emergency care clinics and urgent clinics or urgent care clinics that will also do the testing, and most of them will do them right from your car.
Cheryl, so where are some local resources people could look at to get some more information on what we discussed today?
So Macy, I personally like to go to official Facebook pages. Also keep up to date with the local news, and then of course my favorite is definitely the CDC. So cdc.gov is going to have your most current and official information, and that's what I would go with first.
Awesome. We will definitely check those out. Thank you so much for giving us all this great information,
Absolutely.
Nurse Cheryl. And we
welcome.
will continue to provide you with information on our YouTube page, UCP's YouTube page, about different things happening in the community and trying to keep you updated with what's going on right now in the world. So thank you guys for watching. Please remember to comment and to like the video. We'll be talking with you soon. Hey guys, so I'm here today. I'm gonna pick some of the tomatoes in our garden. Also, I'm gonna pick some of the bad ones. Right now we've got one that died. It's important to make sure you take off any dead vegetables because they'll ruin the plant. But you see we've got this beautiful tomato that's ready to be picked. We also have these other 2 tomatoes that are ready to be picked. And then we're gonna let this one grow a little bit more. It's still a little too green to be picked just yet. But in the next few days, it should be ready for us to come out and here pick it. We also have got lots and lots of peppers. We've got some banana peppers that are ready to be picked. And then we also have some bell peppers that are still growing down here. We still got a little bit more time to grow. But I think this one over here is going to be ready as well. Oopsies. I'm dropping them. Ooh, see? We got a beautiful bell pepper. And some more peppers over here that are growing. You see that we have a fence up. We've had a little bit of a groundhog issue. So we had to build some fences around our garden. We're hoping in the next few weeks that we're gonna get some more vegetables out here to plant, and we'll video it so y'all can be along with us as you watch our garden grow. Thanks guys.